Hi, everyone. Welcome to the Precautionary Principle presented by Public Health Action Network and Air Support Project. I am not Teresa O'Connor. I am Amanda Finley. Teresa's a comms manager, and I do whatever Teresa tells me to, and I make pretty graphics, and I get people, and that's what I do. But Teresa is out for the day, so let's not get too wild. Joining me is our co-host, Keith Muse. Hi, Keith.
Hi.
So we'll do a little bit of housekeeping here. This space is recorded and will be posted onto our YouTube channel. To join the conversation, tap request to come on the mic. Please keep mics muted until you're called on, and keep questions concise. Let's be careful. Let's be mindful of our time. Read our words carefully. And if you hit any snags, just send me a message, okay? If you're new here, you can join our mailing list. airsupportproject.com/join is theirs. And PHAN's mailing list is publichealthactionnetwork.org/contact. Our guest today, I'm very excited that we get to have Sarah as a guest and Jonathan Howard. Sarah Masih, introduce yourself, please. Tell us all about you.
Hi, my name is Sarah Masih. I'm the Executive Director of Air Support Project, and I also work with PHAN. Air Support Project is a 501c3 nonprofit, and we are working towards making the first commercialized version of the CR box to scale, and also working on in the city of Chicago, getting some air purifier rentals and other resources available to nonprofits in Chicago. I'm very excited to be here and talk about the precautionary principle. Thank you for having me.
Oh, I'm so glad you're here. I'm so glad you get to talk about this thing that you are really passionate about. So. Yay. And we have Jonathan Howard. I do have a long blurb here, Jonathan, but it's always better to hear it from the people in their own words. So tell us about yourself, and thank you for being here.
No, my pleasure. But I want to hear what wonderful things you have to say about. No, so I'm kidding. My name is Jonathan Howard. I am both neurologist and psychiatrist here in New York City. I became very interested in medical misinformation and the anti-vaccine movement starting in about 2010. And so when the pandemic rolled around, I was kind of very oddly prepared for that. And I worked at Bellevue Hospital throughout the pandemic in NYU. And I've been writing for the past 5 or 6 years about how, unfortunately, the anti-vaccine movement and medical misinformation has been taking over mainstream medicine, ultimately culminating with the Maha disaster that we're seeing now.
Yeah, that's I studied medical anthropology in school. I'm with the archaeology stuff. I also was fascinated by medical anthropology because I grew up in the medical field, and I guess I just always trusted that we would follow the science. We did not. So, well, let's get this thing started. Jump in at any time. Talk over each other. Don't talk over each other, but. Our first question is, what is the precautionary principle? Let's explain that for people.
So I would say really simply, the precautionary principle is better safe than sorry. And it's something, and Jonathan, jump in whenever, and it's something that really got invoked or used in environmentalism in the 2000s. So it's something that's kind of been used, the precautionary principle itself has been used maybe it's a more recent thing.
Yeah. I mean, I don't think I kind of have too much to add to that.
No.
Hold on a minute. Am I muted?
No, I can hear you. You're good.
Okay, good. Hold on. I got to go get my dog. He's begging to come in. But it's just this sort of exactly right. I mean, just the idea, it's better to be safe than sorry, right? That if you're out on a boat, it's better to wear a life jacket. If you've had a little bit too much to drink, better to call an Uber, right? So let me go get Dexter. Hold on.
Go for it. So, Sarah, I'm going to hop over to you. When and how was the precautionary principle developed? What led to this?
Okay, so I
was going to do history.
Yeah,
that's great.
I don't actually know what led to actually coining the term the phrase the precautionary principle. I do know that it's been used in a lot of contexts within environmentalism, with and maybe when they were removing lead. Sorry, I gotta hit mute and take care of my dog.
Go for it.
Cautionary principle, you would, hide your dog outside while you're doing the show on precautionary principle.
Go, Keith.
Yeah, no, I'm just joking. Yeah, I mean, it seems like it wasn't something that just, was coined and then it was, completely
Yeah.
developed all at once, right? There was a lot of different things, a lot of different strategies and policies and stuff that kind of blended into it. And I can't remember when we looked it up. I think it was 98 or something. Somebody officially coined it, the precautionary
Oh,
principle,
really? Okay.
around there. But I mean, if you were doing anything that, especially in the medical field, that
Yeah.
lent to assuming things could go wrong, or better safe than sorry, then those little policies and strategies were already in place. But we've been talking about it a lot since COVID, obviously.
Yeah.
Yeah.
I
So
mean, I guess you could kind of say it's as old as medicine, or one of medicine's founding creeds,
Yeah.
embodied in the idea of first do no harm. I mean, obviously, if that was the case, no doctors would ever do anything because it might harm someone. So, we don't, truly believe that. But in some ways, that just occurred to me. That's kind of that, this idea, this expression that we should try to prevent things that are potentially harmful.
Yeah. Yeah, the way that you just said that, it made me think of that Saturday Night Live skit with Steve Martin and Bill Murray, where they reel him in the wheelbarrow, and he's missing part of his leg, and Steve Martin comes over and says, "What seems to be the problem here?" And he's like, "Well, I was at the festival of the vernal equinox. This hot skirt came out of nowhere." And Steve Martin says, "Well, what you need is a good bleeding." He's like, "I'm already doing some of that." No, that's and I know don't the origin of hand washing doesn't that go back to the Civil War?
So it actually goes back, I think, before that,
Okay.
or maybe after that. I forget the exact date. I can look it up in a second. I mean, the story is actually pretty fascinating. A very famous person in medicine, Ignaz Semmelweis. He was a obstetrician or doctor. There were probably no specialists back then. Something like Austria or something like this, and he noticed that medical students who delivered babies, the mothers had much worse outcomes. They died of something called, I probably won't say it, like pleural fever, at much higher rates, whereas the midwives, their patients survived. And he didn't really know what the cause was. He thought it was some sort of, bad, essentially, I guess he turned out to be right about germs, but I mean, just sort of bad blood, bad, environments. And he came up with this idea of hand washing, and actually apparently published data showing it was the case. But and the reason why is because medical students would go right from the cadaver lab, immediately to deliver babies. And apparently he published his data and was disbelieved, and kind of famously spent the last 2 weeks of his life in a mental hospital where he was abused and killed there. Some of that may be a little bit not exactly right, so fact check me on that. But I'm 99% sure that I got.
Killed?
No.
I didn't realize.
I mean, he was like abused by the guards. I don't know if he was, officially murdered
Okay.
there, but he was abused by the guards. So, and died there. So. Kind of a real tragedy. And, obviously these days we wash our hands, and now wear masks, which is kind of what COVID introduced into the world, at least in hospitals. And, for the most part, a lot of people aren't perfect, but it's kind of actually shocking when you think about it, that it wasn't routine, 10 years ago, right? That you would walk into someone, a patient in the ICU and not wear a mask. Even though you might have the common cold and the flu, which could be very deadly, dangerous to a very sick person.
Yeah, Melissa, go for it.
I think another story in that vein is the use of gloves. In medical settings really only came about in the 80s because of HIV. And before that, apparently it wasn't routine for doctors to wear gloves.
Yeah. Yeah, my dad's a hospital administrator, so I've kind of grown up in this field. But when I was in college, I worked at a mental health care facility, and we had to do reorientation every year, including bloodborne pathogens. And there's this video, someone standing like in a full hazmat suit, and there's someone just below them on the camera squirting this red fluid up their face. And that was like 1988. and we don't, I just feel like we've abandoned a lot of those things now. Like, we don't
Well, I
care.
guess the question is this, what are we doing now
Right?
that in 10 years or 20 years, everyone is going to look back and be like, oh my God, I can't believe they did that in, 2026,
Right.
So tell me what that is so I can become famous, everyone. But
I will do my best. Yes. I might have to pull
Masking,
it.
purifying the air, UV, far UVC, like those will be like the things that I'm
yeah,
hoping that we will be doing more of in the next 10 years or so. And we'll be looking back like, why didn't we just clean the air? And like, why did we accept like that we're going to throw our kids into a daycare and everybody's going to get sick all the time? And that's just the way that it is.
yeah. Well, Sarah, I have a question for you actually. Let's see if I can share this, if I'm allowed to share things here or not. But I imagine people here have read about this project, this like $500 million
I was going
project.
to bring up Intercept too. So,
Yeah, this just broke like last week.
right.
So I'll just read for this real quick, and then you can tell us your opinion. Respiratory pathogens cause billions of infections each year, from the common cold to the flu and COVID, and now a $500 million investment from Stripe and Anthropic is hoping to financially back the development of treatments that could protect people from many viruses at once. Blah blah blah. Air filtration and offices and airports to remove pathogens. Anyways, I would love to hear if this is something that you're kind of excited about, or if this is some big tech company manipulating us in some
I
way.
mean, I would have no idea if that was the case, unless I read it like on Twitter or something, right? Like, or in that case, maybe the other people here would know as well. But I'm really excited about it, and I cannot wait to actually look to reach out and see what's going on, and see if we can connect. And the way that they just like phrased everything too, like, and if we could drop in that article, that would be great too, because for like other people to see, like, it just makes it sound like so cool and like duh, like why are we getting sick, why are we getting colds, so and the people who are doing it, I haven't looked too much into it, but one of the uh it people involved is from Stripe, maybe like
Yeah.
yeah, so very cool, and I'm just like really looking for, and I think I'm hoping that's going to be like, like our new thing is why get sick, it does, and they really do show in there like things like I think it's like the average person who's healthy, they said, has like 15 to 21 sick days like a year that they take, and that's like that's a lot of
Almost a
days.
month.
Yeah.
A lot.
Yeah, and I think, we're finding that a lot of these viruses seem to potentially lead to very bad kind of other, diseases in the future. The main disease that I treat is multiple sclerosis, and I think that is pretty definitively caused by Epstein-Barr virus at this point. There have been a lot of studies coming out showing that the shingles vaccine seems to lower the rate of dementia. So, it's fascinating stuff what these viruses can do to us above and beyond, potentially making us sick. And who knows, how many are kind of lingering in our bodies, that we don't even get sick from, but may end up causing
There. Yeah.
cancer later on, like HPV. I mean, who knows?
Yeah, and I did an article with National Geographic in 2022 linking COVID and Alzheimer's. I have people are dropping like flies in my long COVID group. They're being diagnosed with Parkinson's, with dementia, with
Right.
kinds of things.
Yeah. So I guess that's the answer to my question. And what are we doing now that future generations will look back on with kind of disgust is the fact that we are in closed indoor spaces that are not ventilated. It would be kind of the equivalent of swimming in sewage water. So Sarah, great, you're going to save the world. That's great. Yeah.
Yeah, we got kids.
Smoking as well, right? So like people 30 years from now won't be able to believe that you could smoke on a plane,
Yeah.
right? It's like, really? Like you guys did that? And it's like, yeah, it was normal back then.
Yeah.
Babies
Even
were
watching-
just sucking it in, It's like,
even
hopefully
watching-
in the future they'll be like, you guys actually let people get sick all the time? And yeah, hopefully.
Well, when we have our Secretary of Health just swimming in sewage water, we're not setting great examples here.
Right. So this is a lot of what I've written about. I mean, there's going to be forces that are going to be against this because there's a whole movement out there that sort of infections are natural and therefore they are good. The idea that it is kind of the opposite of everything in this group would say, and most people, I guess, but that it is affirmatively beneficial to catch viruses. The first time I heard this was when an old friend of mine, kind of the person who cued me into medical misinformation, not because she was fighting it, because she was promoting it, wrote an article saying in 2014, I think, that HPV vaccine was, excuse me, infection was beneficial because it prevented against the HPV virus, which is kind of like saying,
Okay.
like if you give away all your money, no one will ever rob you or something like that.
It hands, yeah.
Or you can, pregnancy is a great form of contraception. So
Yeah.
anyways, but that idea really became mainstream. And, right now it seems to be the official policy of MAHA.
And that's gonna be frustrating for you and for everyone who's been involved in fighting disinformation. Natalia, Taylor, like we've been fighting these people for how long?
Yeah.
Now they're all there.
Yeah,
That's
no, I mean, it is,
where I'd like to cut in and say, Jonathan, I appreciate you and your books and your posts and everything so much. Like, I started following you at some point in 2020, and like, I really like, I knew I was connected to the truth because like I would like wake up, and like read your posts and everything. And thank you for like the books.
Yeah.
I'm such a fan. Like, I just
oh,
have
thank you.
it's
That's very
like
kind.
it's
But, on the one hand, you're like, yes, it is, not cool that the people who I tried to warn about all got in charge. It is kind of fun in a perverse way to watch them flail around. I mean, there's
Right.
just a giant purge at the FDA.
Uh,
And usually that's not a good thing, but in this case, it is. Some of the leaders there lost their positions, but the true people are suffering are the kids who are getting sick with measles right now in Utah and everywhere else, right? So they are the ones who are really paying the price.
yeah, and in so many ways, like it's not just disease, it's climate change, it's everything. Well,
Yeah.
my kid is 13, and we talked about a lot of these things, and I apologize to him all the time. I'm sorry, buddy, we really messed this up for you. What are we doing?
Yeah. No,
So
I got.
in a reactionary kind of world, and we need to get back to being precautionary.
No.
What do the both of you think we can do to sort of steer the ship? I mean, I know we have to wait for this deteriorated sort of chaos, in American healthcare leadership to sort of go away before we could start, righting the ship. But we're a totally reactionary society right now, and precaution means effort. So it's going to be really difficult to get back to even the baseline we were at, because even before it wasn't perfect, right? You'd still have like a great example of the precautionary principle is condom usage, right?
Yeah.
And still there are people like, oh, I don't need to worry about that. HIV is gone. STIs are gone.
I saw that post the other day that you had, and wow.
Yeah. So do you have any, I guess,
yeah.
strategic ideas that we could use to sort of steer us in the right direction? Or is it
If
just,
now precautionary is even the right word to use, or if this is just more cautionary, because now we know that COVID is bad, reinfections are bad, right? So, like, is it still even the precautionary principle that we would be looking at framing this as? What do you think?
I think oh, go ahead. I'm sorry, Jonathan, go ahead.
Okay, and Melissa raised her hand too, but
Yeah.
I yeah, I mean, I like that. So, cautionary. I like that. I mean, I certainly don't have all of the answers. If I had, if I had the answers,
solve this now, Jonathan?
and was,
Get out of here. Go.
if I had the answers and super powerful, Maha never would have, obtained power. So obviously, the forces that we were fighting against are much, much, much more powerful and well funded and well organized, than the random collection of misfits on this call, right? I mean, we're
Right.
kind of a disorganized ragtag group.
Yeah.
And that's been true of like every science communicator group that I've been a part of. We just don't have, we all have daytime jobs. We all do this as kind of a hobby. And I don't know, like at the beginning of the pandemic, I and many others kind of thought this is going to be the end of the pro-infection, anti-vaccine movement. And, once we saw, you know, thousands to hundreds of thousands of people potentially die because they refused a vaccine. 5 years ago when the Delta wave was ripping through, there were all these headlines, father of four regrets not getting vaccine with the last breath. And those are everywhere. And I thought to myself, this is really going to be the nail in the coffin for these guys. And instead, it supercharged them and empowered them. So I have no idea how that happened or really sort of how to fix it. Because one thing that vaccine advocates used to say, was vaccines are a victim of their own success, right? That we wiped out measles and polio and smallpox. And so, but I'm not really sure that's true anymore, right? We've shown there's a very, very high tolerance for children and everyone else suffering and dying from preventable diseases, and we can look the other way and move on.
I have a thought to that, but I want to get to Melissa's question first.
Yeah, I just wanted to ask, kind of going off of the discussion about MAHA, which is, largely a U.S. phenomenon. Are there, although not entirely, but U.S. is kind of the epicenter.
It is everywhere.
Outside of, the US and Canada and the West, are there any other parts of the world that are not being stupid about this and are actually still, adhering to the precautionary principle that maybe we can look to as an example?
Yes, transmission-based precautions in the hospitals, and I'm going to drop in that link again. Is something that we can look to as a framework. And if this, CDC and hospital healthcare started treating COVID like it was airborne, and they actually use their airborne precautions, maybe we could actually get somewhere. So I think that at least for the hospital settings, there's already this framework. It's just they're not treating COVID like it's airborne. Yeah. But they would hopefully would treat like TB or something else it was different. What do you think about that, Jonathan?
Yeah, I don't know. I don't know what's going on in other countries, super duper well. I mean, I think, an ideal place would, first of all, to set something like the United States, to suddenly adopt any sort of policy, it's not going to happen around the entire country. So I think, they're most likely these interventions to happen in small, homogenous, high trust countries is the most important thing. And that can happen locally in, small, high trust places. I mean, with a trusted leader. I mean, so this would be something, someone like, a Mandami, I'm just drawing his name off the top of my head, but, very sort of charismatic, leader could do. So I think it is possible, but not, there to summon the will in the United States as a whole, it would be extremely hard, I think.
Yeah.
There's a trade-off. It's like if somebody wants, like a Mandami wants to get power, he's going to have to put things like COVID and airborne transmission and filtration in buildings on the back burner, because to deal with the other issues, you need the support. Yeah. And it's a very, I don't want to talk about that topic. So it could cost votes. So it's like a catch-22 for any of our good leaders, right?
But potentially the bright side is it's hard to think of any objections to someone installing an air purifier.
Totally.
Right?
We don't have to talk about COVID. We can talk about dust, or whatever, or we could talk about it. But
the medicine in the dog food.
Yeah, PM2.5.
I made a CR box for my son's 5th grade class, not because of COVID or other airborne pathogens. His teacher, I volunteered at the beginning of the year, and he was like, no, it's okay. And the parent-teacher conferences, he was like, hey, does that offer still stand? My allergies are bad. I'm like, absolutely. So I brought him one. So that you don't have to frame it in, like you were saying, you don't have to frame it in COVID. You can frame it in anything else. And I think sometimes that might be to our benefit to do that.
Trick people into being safe.
Yep, we can trick them. Yeah.
Test scores, absences.
Yeah, I was actually in Thailand and Cambodia in 2005. It was after a wave of avian flu. Masks were common. They were just surgical masks, but most people had masks. And it was just no big deal. They just wore masks.
Yeah. And, it'd be hard to think of, all of the objections to COVID mitigations, vaccines, masks, testing. It's interesting. It's hard to think that that those would apply. The
Yeah.
only potential reason that I could think of people would be saying, and this is a small fringe, but these pro-infection people that I'm talking about, that that how dare you rob me of my right to contract all of these diseases. This is how you build a healthy immune system. This is how you build, what doesn't kill you makes you stronger, and I want my children to be stronger. So they would have to, and that is very much fringe rhetoric. So I think potentially, and that's why this $500 million initiative. I mean, I guess especially if they're able to show data, they install these things in school A and there's no sick days, and then school B, there's dozens of sick days. Although
Yeah.
sick days when you're a kid were pretty cool, but anyways,
All right. Yeah.
at least when you were a kid, but
Yeah, well, our next town hall is going to be with Megan Carbolani on accommodations and kids with long COVID. So,
no, I don't mean to make a joke. I'm just saying,
oh no, no,
but
you're good. No,
but I think you're gonna. I would suspect. Keep in mind that I just got done saying I've been wrong about everything so far, but I suspect you would find much less resistance to that. And I like the way you phrase it, Sarah. I think getting rid of dust too, right? I mean, getting rid
yeah.
of toxins. That's how you got to phrase it.
Pollen.
Yeah.
Yep. Yeah, and it's I saw a brief glimmer of hope during Delta. I grew up in Joplin, Missouri, and they got hammered. Southwest Missouri was a bloodbath during Delta.
Yeah.
It was really bad. Everybody back home knew someone in the hospital on a respirator or on a ventilator. Everybody knew someone who died. And the most hardcore Trump supporter that I know of, he's a good guy. And we can have polite conversations, but he's on the other end of the spectrum politically from me. He posted on Facebook one day, I think I've seen enough. I got the vaccine today. You can make the decision on your own, but everybody knows somebody who died. Everybody knows someone on a ventilator right now. I got the vaccine. And that was just like, oh my God, wow, that it takes a bloodbath. That's unfortunate. That's horrific. And then it wasn't too long after that we just kind of veered away from it again. And I don't know how to write the ship sometimes.
Right. And so all those people ended up voting for Maha. It's inexplicable.
Yeah. I think there's a contrarian tinge to a lot of American politics and personalities. We're just so dug in that we just stop thinking straight.
So for maybe those part of the world, you need to say, the government is trying to suppress air ventilation in schools,
That was my hope with Trump coming back into office. Like, okay, he's going to come in and be like, masks are terrible, and we're going to get everybody to come back over to the mask thing. And no, that first day was awful. I was working at the IRS, and it was awful.
Yeah.
I do have and this sort of leads into what we can sort of lump these next two questions here. Why is it important to talk about the precautionary principle right now, and how did we abandon it? What happened? We've kind of already covered some of that, but let's go more in depth into that.
I think it's important to talk about the precautionary principle because to me, it really gives a good framework to understand what went wrong in the pandemic to me. And when I kind of look at things, just like us or whoever it wasn't like necessarily us, like just saying that COVID was safe for kids. Just like, I remember that being like, I don't know, I think it was like March 2020 that I heard that, like, like it's like old people and people with pre-existing conditions, like, it's like, how the hell would you even know that? Like, because this is new.
What's really weird is just a few weeks before they said COVID doesn't affect kids, they were saying it does because they were seeing all these cases of Kawasaki disease. Yeah. I knew someone in Kansas City whose kid was diagnosed with it. It was like, oh my God.
So yeah, that was really what stood out for me. It was like just like the whole kids thing, and then the other thing was saying, like, just kind of like assuming that it was safe for kids, and it really broke my heart because I would see like parents like send their kids into like grocery stores on masks, and they would stay in the car because they didn't want to put masks on because their kids didn't have to wear masks, and like because of the misinformation and stuff that was like kind of and like people carrying around their baby. Okay, I'm sure we all have stories like that, and I'm just preaching to the choir here.
Okay, preach.
But yeah, and then the other thing was too, I think that like like assuming that it would be like the healthcare workers too that would be the only ones to get it, like even though they knew about asymptomatic transmission and like it was new. Again, it's new, why not protect everybody? But I think that was just very detrimental as well.
I I don't recognize this field. I've known this field. I know this field better than anything. Like I've grown up in this field. This is I was spelling cardiovascular when I was 4 because my dad started this part of the CV unit and he had all these notepads. I'm like cardiovascular, and when I was in the hospital in December. No, I marked people right back out that door. This is the sickest I've ever been. You do not come back out here without an N95. Not a surgical. You come back in here properly. And it just, wow, I should not have to tell respiratory therapists this.
Yeah, and it was kind of interesting where the precautionary principle ended up being like applied in certain areas. Like, oh, we can't, like the public, we don't want to tell them to wear masks because what if they touch their face? And like, like that was kind of stemming from like, oh yeah, like we can't trust the public with it because we can't, so it was kind of thrown around, but maybe in an inappropriate context too, which was interesting to see.
Yeah, I still
heartbreaking. I don't know if it's just the right word, but yeah.
Yeah, and with the background in medical anthropology, where you study what people think causes disease and how you think, how do we treat this?
Yeah,
it still stunned me. Like, wow, how do we?
And I think people abandon it for 2 reasons. I mean, number one, I think we do have to be kind of honest that any mitigation was going to have a natural expiration date in that, the vast majority of people don't want to go to a wedding wearing masks or something like this, right? And, that's just human nature and we have to take that into account. And look, I'm going to include myself in that group. I eat in restaurants. I go to parties when I'm invited. I wear a mask on a train. I wear a mask on a plane, so I'm kind of like, I'm not the most cautious, but I'm still more cautious than most. But not that this is about me, but I just think we do have to recognize, that this, what we were doing in April 2020 couldn't, and no one wanted it to continue forever. So I don't think anyone here is sort of saying, yes, we should still be in lockdown. But that's number one. But number two, there was, again, I think a coordinated, well-funded campaign. When you remember what happened at the start of the pandemic, there was a lot of solidarity. Here in New York City, people were clapping for us. Essential workers were realizing that they had more power than they thought of. Some of these relief acts, I forget the CARES Act, I think, there were a couple of them that were just like, $1 trillion of wealth transfer. And some people saw that and said, we have to put a stop to that. And so we are going to, fake a concern about education in schools. And I'm just so concerned about poor brown children and black children missing school. Is their education? And I'm so concerned about churches and religious freedom. And so there was a coordinated, well-funded campaign to get people to abandon that. And the fact that some people would suffer and die as a result, well, that's just how life works.
The CARES Act also funded contact tracing. I did that for the Kansas City Health Department. Funding for that ran out at the end of the year. We got an extension until March 15th. I got really good at contact tracing, because people don't want to talk. They don't want to tell you anything. I'm getting it out of you, buddy. But it was a really interesting time. And I think I think the approach that I took was not to be like, hi, this is Amanda with the Kansas City. No, hey, Billy, how are you? Hey, I just want to check, are you doing okay? Are you doing okay right now? I just want to check on you first. And then hey, is this a COVID? Yeah, it is a COVID thing. You've been exposed. And I think going in with almost an exaggerated compassion is what helped the most when I was doing that.
Yeah, absolutely.
And people just get their hackles up, and I don't blame them. It's a scary thing, and you don't want to lose. People are, especially in the United States, we're very isolationist. We do our own thing. We're very independent. Nothing's ever going to get us, and that's just not what happens in reality.
Yeah,
it's a perfect part.
And there was a sense too that people who died in some ways deserved it, right? They had underlying comorbidities.
Yeah.
They didn't exercise. That for some reason they deserve their fate. And I don't know if anyone here knows of Derek Barris of the Spirituality podcast. It's a podcast everyone should listen to, but he coined the term kind of soft eugenics to describe this idea that we should let viruses rip and, the strong will survive, the weak will die. And that's how the world should be.
I don't know how I'm here. I don't know how I survived the first two. I really don't.
Yeah.
And I mean,
What's
the strong will survive thing feeds directly into the fascist resurgence that we're seeing now because one of the, kind of core tenets of adherence to that ideology is that some people are inherently stronger than others. And, of course, we as the chosen ones have superior genes. So if we do get infected, we won't die and we won't get sick because of our inherent superiority. Um, and, you know, it- and then, that logic extends to anyone who died deserved it because they were genetically inferior. And I mean, I think the fact that we just followed that line of thinking because of the pandemic has caused a whole fascist resurgence now.
I got involved with COVID Survivors for Change. They have a weekly grief group that meets on Thursdays. And at first, I was the only person who survived. I was the only long hauler, and it was heart-wrenching to hear people like this. Was at the very beginning when they didn't even have cell phones in there. There were no devices. It was just nothing. It was just nothing, and and that we hear that a lot in the grief community. Oh well, did he have a comorbidity? Did he have this? Or they're dead. Okay. This can come into my long COVID group and look at the people who were triathletes. They're in wheelchairs now, and you tell me.
Yeah. No, and I
mean that also is just complete lack of empathy with that response. Someone died and they're like, well, did they deserve it? Were they inferior?
Yep.
Yeah. And I put something in the notes there. This is my science-based medicine article on Friday, I guess, but last week, but about how Kennedy is obsessed with, of all things, I almost sound gross saying it, teenage sperm. He mentions it constantly. And the fertility, the pronatalist movement, babies are good. I love babies. We need more babies. But just this idea that certain people, right, not the Somalians, not the Haitians, not the Syrians, should breed and have more babies. There are dark echoes of that as well. The Nazis had a program that was kind of the opposite of the Holocaust. Instead of trying to kill the undesirables, trying to breed them, trying to breed pure race Aryan babies, and they got, all the best food and all of that. So, yeah, no, I mean, so I'm just saying, Melissa, back to your comment about, the fascism. Yeah, right. I mean, we sound alarmist, at least I kind of feel that way, alarmist about, saying that, but it's got to be honest, right? It's true.
Well, one of the states that's been hardest hit with long COVID is Oklahoma. 1 in every 3 people have long COVID. Senator Jim Inhofe died from long COVID. I work a lot with Michelle Lynn at Fox 23 in Tulsa on long COVID stories, and they still just don't see it. They just don't see it. I don't know how else to
blame it on something else.
Anything else, anything.
Yeah, Kennedy's son has long COVID.
Yeah.
And he shuttered the long COVID office, right? Didn't he do that?
He did. It wasn't really doing a lot anyway, but
I mean, don't assume that fascists want all their children to survive.
Yeah. Fair point.
Yep.
Wild.
Yeah.
That's right, Rosemary Kennedy, right?
Oh,
yep.
Hey, Tanya. Hey. Yeah. What are I'm kind of running out of questions here, so we're probably going to wing it. What are some examples of how the precautionary principle plays out in real life? What are we seeing right now? What could we see? What are things that we haven't talked about yet?
I would say child safety stuff. I've been doing a lot of that stuff, like, covering the outlets and blocking the stairs off and stuff like that, making sure the locks work, whatever. You don't want to leave the fence open.
Yeah. Kansas City, we have had over 90 tornado warnings just this season in the KC Metro. I've never seen anything like this. Like, I've grown up in this area. I know tornadoes. Like, I've been through a few. I've never had to hide 5 times in a season. This is just nuts.
Wow.
And because we're defunding a lot of the National Weather Service projects that help create these predictions, we're missing storms. And someone died in Wichita the other night because of this.
You know, the precautionary principle is everywhere. That we don't even notice it, right? I mean, fences around pools, things like that, and things like that are not controversial. Although who knows these days,
Oh, yeah,
tried to make fences around pools, people would probably say it's my right.
yeah.
Let the neighbor's children wander into my pool.
Gosh, it's this rugged individualism that's literally killing us.
How else are they going to learn to? But the precautionary principle is everywhere. Every time you look both ways before crossing the street,
We're supposed to do that. I'm still man.
I used to tell my kids, look up to make sure no piano is falling, look down to make sure there's no quicksand, make sure to look both ways. But anyways,
I'm the eternal Girl Scout, so I'm trying to be prepared.
It seems like there's this this refusal to be safe now,
Yeah.
because and it's been supercharged, like you were saying, Jonathan, about the anti-vax movement. It's been supercharged by any form of government overreach or mandates or rules or whatever that could protect people. It's kind of like all of society is that rebellious teenager now. Anytime you mention anything about, hey, put on your bike helmet, it's like, I'm not living under the government rule, sheep. And it's like, it's really bad. I mean, it's a psychological, sociological phenomenon. Very tough to deal with, right?
no, that you took the words out of my mouth, at least with the rebellious teenager. I think I was going to stay stupid teenager. I mean, I rejected, that's probably what a teenage boys did, the precautionary principle when I was growing up, driving fast and, just exploring all sorts of abandoned places and, not taking any sort of precautions because people have the sense that I did back then that, nothing bad's going to happen to me. Right. That's I still have a little bit of that. We probably all do, right?
Big
Oh,
time.
for sure. Yeah. Yeah.
And by definition, everyone here on this phone call is still alive. Everyone who did something stupid and died is no longer here to talk about that, right? It would be very interesting in some sci-fi world, to hear, what all the people who died of COVID, if they could come back and be like, yeah, you know what? We actually underreacted, and my death is part of that. But they're no longer here to say that, are they?
Yeah, and we've even had very striking visuals, like with COVID Survivors for Change. We did that thing with the white flags on the National Mall a couple of years
Yeah.
ago. I knew names on those flags, and it just seems like they don't.
And this is
The flags don't matter.
and this is why long COVID victims have kind of become, an enemy of some way, and there's a sense that, you don't need me to tell you this, that they're not believed, right?
Yeah.
That it's all in your head and it's all sort of that there's something fundamentally wrong with you. For example,
Yeah, I
the,
just yeah.
the former head of the biologics division at the FDA, Vinay Prasad, used to make jokes about long COVID patients. Or Marty McCary, wrote an article in the Wall Street Post or Wall Street Journal, the exaggeration of long COVID, he called it.
Yeah.
Jay Bhattacharya, the head of the NIH and FDA, excuse me, in CDC, in an interview in October 2020, he was talking about teachers. What is your, teacher's risk? And he said, they only have a 1 in 500 risk of dying. And essentially, we can ignore all non-fatal outcomes. So, long COVID patients are a constant reminder that death is not the only bad outcome. And so there's a need to sort of marginalize those voices.
It's a liminal area, though. You still die from long COVID. It just takes a little longer.
No,
Every day I wake up and I'm like, who am I going to lose next? Who am I losing next? And if someone goes quiet, I kind of get a little nutty. I just start searching for obituaries, and I don't like finding people that way, but I do.
That's morbid, but I'm sorry.
Yeah. Someone who really helped me out through some very dark times when I was still living in a tent. She went quiet, and I went searching, and I found her.
Yeah.
And people think that, long COVID doesn't kill. It just makes you tired. It kills. I'm here to tell you it kills. It kills slowly, but it kills.
No, yeah, you make a great point that I think gets forgotten, that the COVID death toll is probably undercounted.
Yeah.
Like how many people would still be alive today if COVID had never happened, right? That'd be, fascinating.
And the first person we lost in my group was someone I was really close with, and I kind of lost it. I kind of went, but I was in the woods and away from people, so I was like screaming at trees and turkeys, and not a pretty time. It was not a pretty time.
Yeah.
But and I feel like I've switched from doing advocacy to mass hospice, and the world just doesn't care.
It's like Jonathan was saying, but whoever gets long COVID is just they had, underlying conditions, and
Yep.
It's too bad. We're all super strong, even though, super athletes, tennis players, Olympic athletes, hockey players, basketball, football, it doesn't matter, still being impacted. And it's like, did they all have underlying conditions? Like, come on, gang. And it's illogical to think that because you don't die from something, it's okay to do it, right? I mean, it's car crashes, burns, you can get burned all over your entire body and have your entire life impacted and not die. Does that mean it's okay? Does that mean it's fine? It's just, we're just thinking very cut and dry. And it's like, if you don't die, it's okay. If the kids don't die today, well, what could be the harm? There's no foresight whatsoever. It's
like I know my time is limited. I don't know how much. None of us knows how much time we have left, but I know I'm probably more limited than the average person. I've got a 13-year-old, and that song from Hamilton is always in the back of my mind. Why does he write like he's running out of time? Because we are running out of time.
Speaking of which, I have to run because I just got
please, yeah. Thank you so much, Jonathan.
No, thanks, and I hope I didn't dominate Sarah. I hope I didn't take too much.
It's so good to see you again.
Your time.
I'll send you that Block by V shirt, okay?
No, we did great together. Thank you so much for your time.
No, thank you guys. I'll be back anytime you want. All right.
Awesome. Thank you.
Take care. Bye-bye.
Yeah.
Here, let's hey, Melissa, did you want to go ahead and ask your question?
Oh, I was just gonna say, it's probably, that's the thing we were discussing earlier, is probably related to why we keep trying to sweep disabled people under the rug and keep them from being visible in society, because that is a reminder that there is an outcome other than death or you're completely fine.
Yep. Well, you got a loud, crazy woman in a tent in the woods who's going to make sure that no, that's not going to happen. Nope.
But historically, you had the mass institutionalization and the ugly laws, and
that's all coming back.
Now the fascists are trying to bring that back.
Yep. It's scary. It's really scary, but they haven't. We're a lot more organized thanks to virtual organizing. Like this is something that we haven't really seen before. We can be flat on our backs in bed and still organizing, and I just think that's amazing. Like these are people who are changing the world from their bed. Watch out.
Yeah, the internet is an accessibility tool. Absolutely.
Very much so. Yeah. So did anybody in the audience have any questions? Anything else you wanted to bring up? Tanya, I'm sure you probably have things to say. I'm so glad you did it.
I'll say hi. I was curious. I came in a couple minutes late. As far as like precautions, what do you? I know, I'm always talking about far UV. That's like, I'm like that far UV girl. So like, what are your thoughts on that? Was that brought up at all?
No, we were talking more about the precautionary principle, not so much the precautions, but the principle behind taking the precautions.
Okay.
Tanya,
Oh, go ahead, Melissa.
Tanya, this is an aside, but we actually need to talk to you about far UV.
Yeah, that's what I was going to say.
We can set up another meeting.
Okay.
I want to be that far UVC girl too. So
yay!
On Wednesdays we wear pink.
I love that. Let's make it a far UV movement. Yeah.
Absolutely. Like that would be so great.
Does anybody else have any questions? Any other thoughts that you wanted to bring up? Go ahead and raise your hand, and if you do. And if not,
hi, my name is Jacob.
Hi, Jacob.
I'm Tanya's friend.
Oh, okay. Oh, yeah. Okay, yeah.
Wanted to give some hope. I had a long EBV in college about 15 years ago, from freshman year till a few years out of college, and I was able to recover from it. And I know a lot of the similar mechanisms that overlap with long COVID, with post-viral illness.
No, there's some.
Yeah. I actually
Quite a
started
lot,
my own
yeah.
health practice because that's what inspired me to start my own health practice. So I work with a lot of long COVID clients, and actually one of them just published his book. He's doing better than he was before he got
Oh yeah,
COVID.
great.
Yeah,
Great. No,
yeah.
that's very rare.
So
Like
there's
the one
hope.
thing
It's
there's
not too rare. You just need to find the right people.
I've got
And a lot of
17,000 people in my long COVID group, and it's start times.
yeah,
Start
yeah.
times.
Well,
But yeah, I thank you for
thank you.
sharing that. There
My
are
pleasure.
like I've got some people who are doing great now, but
Yeah.
God, it's just so hit or miss. Like I don't know.
And it's still so early.
Yeah, you're right. You're right. REG and I talk about this all the time. Like I know it's been 6 years, and people, what, 6 years? That's really not that long.
Not a long time. Yeah. Like who's going to relapse? Are the people who have had long COVID, are they
Right.
just like, we don't know.
Yeah,
And
like the
there's
long-term
setbacks.
disorders are going to be crazy. Just like how Epstein-Barr virus is linked to like thyroid disease now. Like we don't know what COVID's going to bring. We know it has some vascular issues, but what other like
Oh, no, no.
neurological issues it's going to bring?
Because it affects every part of the body. I got people being diagnosed left and right with Parkinson's. I've got people being diagnosed with Alzheimer's. I've got people being diagnosed with all kinds of cancers. Like one of my group moderators, she has a parathyroid tumor now that she's got to have removed. Like it's just one thing after another, and my phone blows up all day, every day. Hey, have you seen? Yeah, I've seen this. I'm sorry. I'm really sorry. And it's scary. And all we have to do, like prevention. Don't do this to other people. Don't do it to yourself.
Yeah.
And we just can't seem to get that message across. I don't know. I don't know what the answer is, but
So I started working on a project with my father out in Arizona, which we're bringing to Florida here,
oh
which
yeah,
are healthy homes.
oh yeah,
Essentially, the
cool.
concept of having superior air quality, superior like building quality, so like you can't have water damage or mold, superior water quality, so you know what you're drinking is pretty much water with minerals.
Okay.
Um, so actually, during the pandemic, when everybody was locked down, I took my truck camper on my truck and just went all around the U.S. Remember how there was all those fires going on?
Mhm.
And I found that this place in northern Arizona called Sedona didn't
Oh,
have
that's
any
beautiful.
fires, like any smoke. Everything was just blowing over. It was amazing. So we were gonna build out there, but unfortunately my parents don't mask, and
Uh,
my father recently was diagnosed with dementia,
oh,
which is a familial disease, like it runs in my family, but I think COVID kind of, sped that up. So we're now bringing that whole project to Florida.
wow.
That's where he is. Yeah.
Okay. Okay.
He's been a developer for 40 years, so, and I'm in the health realm, so
Yeah.
there's some synergy there. I've been trying to develop these healthy homes even before COVID was a thing back in 2017. A lot of clients I worked with and myself had issues with mold, so we knew all about water damage and poor indoor air quality.
I think there's someone I want to talk to you about, and I think we're connected on LinkedIn now. But I'll catch you later on this. I've got an idea.
Cool. Yeah, for sure.
Anybody else have any questions or anything you want to bring up while we're here? Mhm.
Are you
Going
on
on?
LinkedIn? I don't see his name. Person who's talking.
Oh, Jacob, I
Oh,
can I
Jacob.
can connect you. I can connect you.
Okay, yeah. There's somebody in Florida I was just thinking about connecting you with.
Cool.
Awesome.
Awesome.
Yeah, that's well, I want to thank everybody for being here. It's always a pleasure to do these and to have our lovely guest. Thank you, Sarah. I'm glad we got to spotlight you this time.
Thank you for
And of
doing
course,
this.
Jonathan. Jonathan has just always. Jonathan has spoken at least one of my virtual protests. He's a great guy. He's done a lot of work. So COVID does remain an ongoing airborne threat, and clean indoor air reduces risk now. Keep pushing for MERV 13 filtration and use a high Cater purifier. Stay connected, join our mailing list, and get space replays at airsupportproject.com. Take care and breathe easy.
Thank you.
Thank you. See y'all later.
Take care, everybody.
It's good to see you all. Thank you for doing this.